part 3 of our CryoClear certification course. In this section we'll be looking at common skin growths that are generally considered benign, but different from the other sections in that pigmentation is not the main culprit, but rather the growth or morphology appearance of the lesion is what makes the difference. The first one we'll look at is cherry angiomas. Very common, high percentage in the population, depending on what statistic and age group. It's well above 40 to 60% of the population will appear with cherry angiomas. Cherry angiomas are non-cancerous, harmless spots that may be seen. The growth is generally occurring because of some underlying issue. It could be something as simple as stress as a causative factor. However, there are potential indications here of liver disease that also may produce cherry angiomas as a sign. Genetic factors are also held to be responsible for the growth of cherry angiomas, and there is a familial track that may be seen when looking at genetics. They're regarded as a condition that is completely treatable, generally without complications. If you would bump or bruise or cut any of the cherry angiomas, they will bleed. And of course, with their appearance and location, which oftentimes is on the face, there's a psychological distress that comes with changes in appearance. And so it's very common for people to ask how this can be gotten rid of. And of course, CryoClear and cryotherapy is one of the potential methods that may be used. So we see these as we age. Again, like most of the aesthetic issues that we're taking care of, we see that as time goes on. The growths are often collected around one another, but they can just as often be sole and just small spots. They're often a 1/4 inch in diameter. They're smooth, bright, and cherry red. They can also appear with spider-like veins, and so we have spider angiomas as well as cherry angiomas that may be present. Skin tags are the next growth that we'd like to talk about in the course. So skin tags, also known as acrocordons, cutaneous tags, fibroma molluscum. There's a number of names, Templeton skin tags, but basically they're all small, soft tags of skin, which have a stalk and then a pedicle, which is hanging off the base of the skin. So they can appear on any part of the body, but most often they appear in places where either clothing will rub or there's an accumulation of tissue. So eyelids, armpits, under breast, groin, upper chest, and neck. They're invariably benign, non-cancerous. There's no real symptoms. They're more aesthetic than anything else. And so oftentimes people will ask for them to be removed, which can be done a variety of ways, including cryotherapy. And so skin tags become one of the easiest aesthetic growths that could be treated. Spider veins is our next one. And this is one that is seen across a broad spectrum of the population. They're very common in healthy people as well as those with disease. They're generally caused by sun damage and or aging. When seen on the legs, they do not necessarily indicate a vein disorder such as varicose veins or underlying deep vein problems or circulation. They seem to be an outcropping of other issues, including scleroderma, hemorrhagic forms of spider veins, xeroderma, all which may be treatable in a variety of ways. Seborrheic keratosis is the next one that we want to mention, and that these are due to excessive growth on the top layer of the skin cells, usually found in persons over the age of 30. They appear in growths, single growths, or in clusters, often brown, but their size and color can vary from light tan to black. They The telltale feature of seborrheic keratoses is that they look like they've been pasted on the skin or just stuck onto it. They're so different from the surrounding tissue that its appearance really stands out. It's almost like a brown candle wax dropped onto the skin as it melted. So, and almost everyone develops these over time. They get more numerous with aging and are oftentimes called barnacles of old age. Never an endearing term, but it is one of the more common. Now, sebaceous hyperplasia is the last one that we want to mention, and this generally starts with yellow small growths, keratin forming or accumulating inside the pore. The skin disorder shows that the patient has an overgrowth of some of the glands on the face, and sebaceous hyperplasia appears as these small yellow bumps up to 3 millimeters in diameter. They're commonly seen in the face as white raised papules with a central depression. They're harmless, but they will not go away on their own and do not require any treatment. They're strictly for cosmetic reasons, and so sebaceous hyperplasia can be difficult to clinically differentiate in some cases from other indications. However, there are some features. Keep in mind that there may be an ethnicity to it, but the signs are basically enlargement of a sebaceous gland, and the appearance is acne-like. They are yellowish white raised papules. And so sebaceous hyperplasia, again, is one of these that affects a large segment of the population, and you'd like to be familiar with. Again, mostly seen on the forehead and cheeks of middle-aged and elderly. This concludes our section 3. You can turn to the quiz.